Well, hello and welcome to this Wednesday afternoon coronavirus chat here on Neuse News Facebook page. I'm your host and publisher of NeuseNews.com, BJ Murphy. Thank you again so much for joining us. This is actually a conversation I've been wanting to have for a solid 2 weeks now, and I'm really excited about the special guest we have on today's show. But first, I want to make sure, if you haven't already, please make sure you share this broadcast, because we're going to have a conversation about mental health. And I think this is a conversation that needs to get more out in the public. And we got Beth Sailors on the line with us today, as well as Dr. Pradeep, who's been no stranger to this broadcast. And he's going to give us some of the latest on COVID-19 and some other trends and things we'll chat about him. In fact, if you'd like, you can feel free to go ahead and ask some questions in the comments, whether it's regarding mental health or best practices when it comes to COVID-19. Feel free to start dropping them in, and we'll do our best to get to them as the show goes on. But this morning, the North Carolina Department of Health and Human Services announced that there are now 3,426 cases across our state, 53 deaths, unfortunately. Lenoir County's got 11 cases. Greene County has 10, and Jones County upped their number today. They now have 3. Just a while ago, I got a chance to watch and listen to the governor, his press conference, and he mentioned, we just published this story a while ago, that an Orange County nursing home has 60 positive cases. 7 of those individuals have been hospitalized. Unfortunately, 2 have passed away. And so he's very concerned about nursing homes as being hotbeds across our state. And so expect an executive order on that topic here real soon, if he hasn't already released it since I've got off the press conference. And there's also going to be some more North Carolina Department of Health and Human Services guidance to nursing homes and some more. There's going to be an executive order related to retail establishments here real soon too. Also, if you haven't already, make sure you are subscribed to our daily newsletter. It is neusenews.com/subscribe. It is basically all the day's top headlines. As always, everything we do here at Neuse News is free for you to consume. So feel free, just subscribe to it. You get that email at 7 a.m., all the day's headlines. In fact, even the last day or two's headlines as well. And also, we started a program called our Breaking News Text Alert here about a week or 2 ago. We've got well over 700 people. I think we're over 800 now signed up for it. Just simply text the keyword NN to 484848. That's NN to 484848 to sign up. Again, it's free as well. Really happy about this next video we're going to show you real quickly. It's from Lenoir Community College, and just a little bit of optimism, which is something we all need right now. And that is right. Better days are coming. Thank you so much, Lenoir Community College, for that special message. In fact, if you want more information about how the college is handling COVID-19 or what they're doing to make adjustments, just go to lenoircc.edu to get all the latest from our partners and friends at Lenoir Community College. Really excited about our first guest this afternoon. Beth Sailors is no stranger to Kinston. She is a licensed psychological associate. She is a downtown small business owner right here in downtown Kinston with ENC Psychological Service. And she is on the phone with us now. Beth, thank you so much for joining us this afternoon.
Thank you for having me, BJ. It's a pleasure to be here.
Thank you so much for calling in.
Technical difficulties.
Yeah, and I'm a little grainy today too. It looks like we're having a little bit of technical issues all the way around, but that's okay. This is a very important topic. It's something that I've thought about as a parent for a lot of the last 3 weeks. I'm sure a lot of other folks have, and that is, Beth, the status of students being at home, parents being at home. What are you seeing in terms of trends as it relates to the coronavirus?
Well, this is definitely an unprecedented time. There's no rule book, no framework for how to work within this. So I'm encouraging my families to show grace towards each other, towards their children, and to understand that there's no right or wrong way to do this. One thing that I am recommending is, especially with my older teenagers, that the parents do understand that they may need a little bit more space than the parents would like for them to have. You know, they're used to being gone from the home for 7 hours a day, and now they're home 24/7. And that can cause a little bit of conflict and just other issues. So I'm encouraging family time, but also alone time to reflect, to be mindful, to meditate even. We've had some beautiful days. Get outside, take a walk. The more that we can respect each other's space within this, the better.
Yeah, it's my wife is a teacher, so she's staying at home, but she's working, and then my kids have some Zoom classes or some seesaw programs, and trying to strike this balance between using technology and then having lunch and then have some outside time, and my wife not being able to be right on top of them, during the course of the day has been a challenging for her, and I know there are a lot of teachers that are experiencing that very same thing.
Absolutely. I definitely feel for the teachers who are also parents. So they're trying on one hand to teach a Zoom class, but also teach their own children. So I understand that's a challenge as well.
And let's talk a little bit about medical professionals, if you don't mind. I mean, they have
Sure.
a tremendous amount of stress on them. And, what do you say to, what kind of advice would you give to our medical workers who have not only a tremendous amount of stress when it comes to their job, but a lot of them also have kids at home too?
Well, I would ask them to seek out help. You know, there are many mental health professionals and counseling agencies out there that are still open, still providing services through telehealth, online, over the telephone. I would encourage them, if they're able to reach out for help during this stressful time. And also try, and I know it's hard, to do some self-care, to get some sleep, to try to eat healthy. Because the first thing usually to go for those people in healthy professions is to take care of themselves.
Mm-hmm. They're always concerned about other people. I certainly understand that. And, one thing that I have not seen any reports on, but something I'm kind of, I'm a little scared to do too much digging just yet because I'm afraid of what I may find out. But that is families where there have been some family trouble, maybe even child abuse challenges. What are you saying to families or people who are in those types of situations?
That is very true, and that is something that is very concerning as well. Child abuse, domestic violence. It's already a very stressful and high anxiety situation, and that compounded with already pre-existing factors can be a powder keg. So I'm, encouraging those who are in this kind of situation to reach out to authorities, the safe house, go stay with friends, because that's a very unhealthy environment for anyone to be in.
Right. And if you're watching this and you know someone who's going through this, or you are yourself, we just like Beth said, please make sure you're reaching out to the appropriate authorities. The SAFE in Lenore Greene County is a great program for women and families going through domestic violence and child abuse. So I just want to make sure we mention that. Just let's talk a little about the other side, and that is, people have lost their jobs or they're on temporary layoffs or furloughs or concerned about their future. They may not have enough money in the bank for the next 2 or 3 weeks. What are some things you can share with people to help them overcome that anxiety and that potential depression?
Well, I'm trying to encourage people to remain optimistic. I mean, that was a great lead in. Better times are coming. I do feel like we're going to come out on the other side of this, and I'm encouraging people to stay in the moment. Don't jump ahead to what's going to happen next week, next month, 6 months from now. What do things look like today? What can I control today? If we start jumping ahead to all the things we're worried about, it's going to cause so much more anxiety. So just stay mindful in the moment. And I'm also encouraging parents to, if they can, hide their anxiety from their children. Children look to their parents as the measuring stick. If mom and dad are freaked out, I need to be really freaked out. So if you can try to keep it together as best you can and let your children know that you've got this, then they're going to be much better for it.
Right. Yeah, it seemed like they would cling to some of that optimism, but they would also cling to some of the negative energy as well. So trying to show some of that positive energy, knowing that we are going to be okay, is both tough, but also probably necessary. I think that's really good advice. And in terms of, like your personal caseload right now, how are you handling seeing clients? Are you seeing a rise in telehealth in your profession?
We are, and I'm happy to see that. We are able in my office to do telehealth through a video Skype type thing. It's HIPAA compliant. It's not your typical Zoom or FaceTime. And it's been received really well. And we also are able to do phone call sessions. I prefer the video session, but in areas where you might not have as good internet service or accessibility, it's another option. And Health and Human Service has just authorized the telephone calls. So that's unprecedented for us. So
I did not realize, I did not know that. That's important to note. I like that. I'm sorry, keep going.
And in fact, next week, I personally am going to be going totally to telehealth until May.
And before we get to Dr. Pradeep, because I do want to bring him in here in just a moment, are there any other final points that you want to make sure, or any other concerns that you have, or anything that you know that people can do to help? Or if they need help, is there a phone number or anything they could call?
Well, I've seen some wonderful things come out of this. I am always telling people to focus on the helpers. I have seen so many wonderful things come out of our community. And I encourage people who are struggling during this time, like I said, give yourself grace. Don't try to do 800 home projects and take up a new hobby. Just try to maintain. Try to be there for your kids. Try to maintain a little bit of structure, because when the kids go back to school, if they've had no structure, it's going to be a big reset. So towing that line between being home and fun and a little more structured, and just remaining optimistic. We're going to come out on the other side of this and maybe learn that we need to focus a little more on our families, slow down a little bit, and, stick to what's important.
Mm-hmm. Well, thank you so much, Beth. I definitely want to make sure we bring you on here again, because there's a lot more. As I was going through my list of questions for myself, I was like, this is a conversation I've been wanting to have. It's been pent up in me. And I think there's a lot more areas we can dig into here, and a lot of places that we can actually help people who are going through this. So thank you so much for taking some time this afternoon to be with us.
Anytime.
All right. Thank you again. And again, that, ladies and gentlemen, that was Beth Saylor. She is a downtown business owner. She owns ENC Psychological Services. She is a licensed psychological associate, and we're really lucky to have her in our community, and very thankful that she took some time to be with us this afternoon. Another guest I want to bring on here is Dr. Pradeep, who's no stranger to this broadcast, and he has definitely been studying this issue of the coronavirus on the other side of the medical spectrum. And Dr. Pradeep, it's good to see you this afternoon.
Good to see you too, Vijay.
So let's first talk about some trends. I mean, we've talked over the last few days that we're in that time period right now where we're going to start seeing some peaking. Are you seeing that as you study the trends across the country and our state?
So if you look at the trends across the country, it started off doubling every 2 days, 2 days, 2.2 days, 2.3 days, and then slowly started increasing. Now it doubles almost every 6 days. Now that is a good sign. I mean, that means we are slowing down. And if you look at the map from the graph from the Financial Times too, you can see it coming down. For example, if you look at the number of new cases in the United States, it's only 26,000. Yesterday was 31,000. So if the number of new cases is lower than yesterday, that's a good sign. That means you have crossed the hump. You're going to slowly start coming down, hopefully. Okay. So social distancing seems to be working. Now, if you look at North Carolina, for example, we are still not there yet. The IHME, that is the Institute of Health Metrics and Evaluation, it's a University of Washington thing. They predicted North Carolina to peak on April 15th. Now, there is some controversy regarding this. The only reason I say that is if you look at the UNC Duke studies, they expect close to 250,000 people in North Carolina to be infected if we continue the social distancing policy through May. If we lift it at the end of April 29th is when we are supposed to lift it. And I have a strong suspicion it's going to be extended. Okay, if it is not extended,
that's actually a
then
question
we are going
I've got for you. Yeah, the question I've got is now the time to either stay the course or loosen the restrictions or even be more strict? I mean, where do you see us needing to be right now?
At this time, I would say stay the course. I do not think there are very few people out there who are going to say lift the restrictions on April 29th. I suspect most Republicans and Democrats are going to say extend it through May at least. Now, there's always this problem: are you going to kill the economy doing this? And there's no answer to it. Now, the North Carolina Department of Health, the NCDHSS, published a document yesterday saying if we lift it on April 29th, then there is a 50-50 chance that you're going to overwhelm the system. And if you lift it on April 29th, there are going to be 750,000 people infected. If you continued it through May, it's going to be 250,000. And these are all predictions. Who knows if it's going to come through or not. Now, if it is 750,000 people, and even if you took one person as the mortality, if 1% mortality or 1% death rate, that's 7,500 people that are going to be dead within the next 2 months. So if it's 250,000, it'll be 2,500. To put things in perspective, right now the number of people who have died is 53. So we are making such a big issue with 53 people dying, but imagine what it would be 2,500. All of us are going to know somebody who's died of COVID-19 if we don't continue this. Now, the NCDHSS and nobody is saying we should continue this forever, but at least for the time being, maybe extend it through May.
And that's a tough pill to swallow for a lot of people, both government leaders, medical professionals, parents, teachers. I mean, that's tough for everybody. But I think that there's this balance, as you mentioned a while ago, between what is best for our overall economy and what's best for our health and the infrastructure that we have. I mean, I've been on personally over the last week and a half. I know every other day, at least, I've gone to Amazon or Walmart.com and I've tried to look to see what type of antibacterial or Clorox wipes or toilet paper, some of these basic goods that we need to protect ourselves and defend from this bacteria. And you can't get access to hardly any of it still. And at some point that system has to catch up. So a question I've got for you is, on the private sector side, have you seen private industry step up to the plate to help fill some void in medical supplies, whether at the hospital or in the stores?
Yes, in a lot of these local companies and national companies are making more and more masks. They have changed their equipment, everything towards making masks and protective equipment, ventilators and stuff. So that should help. Should have been done a long time ago, but we are where we are right now. So, and if you just look at LCC, for example, Dr. Hunt donated 200 shields, face shields, that they 3D printed in LCC. Things like that, which we would never have thought about before. And I think the hospital is going to order more of it. I don't know if that for a fact, but those are the kind of things that that have really helped.
And LCC has definitely been a good community partner. They've been a big help here for us at Neuse. In fact, I don't know if you got to see it or hear their message earlier that the better days are coming, and I think they've got the right attitude about it. This is really, really dark times for our country, but better days are coming. And as Ms. Saylor said a while ago, that parents really should continue to put on that positive energy for our kids, because they're going to feed off of that. And you're a medical professional, and we talked about your daughter the other day. Is she feeding off your energy as well?
She is, and actually, the reason why I'm in this dress is because I put up a water slide for her. I'm beginning to enjoy staying at home. I don't know if I will want to go back to working full time like I did before. When I first came to Kinston, the guy who sold me his house, Bob, he said, Bob Nielsen, he said, you have to stop and smell the roses. He was 80-something years old. And I'm going, yeah, at your age, you can afford to do it. At my age, I still have to work, But now I see what he was saying, Right. I am smelling the roses. And I would imagine
you would have a few upset heart patients, though, if you did that more often.
Yeah, I know.
I'm
just kidding, but.
Look, and if you have a question for Dr. Pradeep, please drop them. We do have one question for you. That is, do you believe that has social distancing had any effect on the number of flu cases that have been reported?
See, we were at the end of the flu season when this came on, so you can't say for sure, but the flu numbers have dropped dramatically. Is this because of social distancing? I'm pretty sure it played a part in it. But how much of it was just because we were at the end of the season? Is it, now if we were doing this in January, February, and then it dropped down, I could say yes. And I'm sure, if you think about flu, it's almost transmitted the same way as the coronavirus. So it should go down. I don't think this would make any difference just because it's the flu.
And in the office, we've got a skeleton crew here because of all this. But we've talked often about how much over the last 2 or 3 weeks, from the coronavirus task force to the CDC, how much the guidance and the policies have changed from trajectory of the number of cases to N95 masks to now cloth masks. I mean, this has really been a perplexing issue for the medical industry. Wouldn't you agree?
Yes, I do agree. Those are tough things to, even in the hospital in Lenore too. Not just Lenore, every hospital out there is having trouble with these PPEs. Majority of our stuff came from China and the other countries in which we are not getting at this time. So. We are reusing masks, we are re-sterilizing masks and all that, things that I never thought we would be doing. So this is a tough time. I mean, it's very stressful on the healthcare worker. So, these nurses, the respiratory therapists, all of those people, if you think about it, who wants to reuse a mask? I mean, you're not used to reusing a mask, So these are all tough times for everybody. And we don't have a choice. We have to go into the hospital,
Right. And you need to wearing a mask is better than not wearing one, I assume. But it's still, the cross contamination is a serious issue. I get it. And any other advice you want to give the people watching today? I want to say again, thanks to everybody watching. Please share this broadcast, because there was some great information earlier from Beth Sailors, and I also hear from Dr. Pradeep. I mean, my biggest takeaway so far is that he wants to stay home for a living now. I'm messing, but any other advice? There is another question I've got, but any other advice you got for the people as we hit this so-called peak time of this coronavirus?
Stay home. There is good news ahead. I mean, things are getting better, but now is not the time to relax. Okay, now is not the time to. It is getting better because of what we have done so far. So let's not get. We have come so far. Let's not go back.
And one final question I've got for you. And I definitely don't know the answer to this, so I'll at least toss it out to you. Has the flu shot helped anyone so that they won't get the coronavirus?
The flu shot is for a completely different virus. So no, it does not help with the coronavirus at all. Okay. No, there's no cross reactivity. I mean, I wish there was, but no.
All right. And your final tips on social distancing.
We have been hammering on this for the last 1 month, I think. I don't know what else to say. Just be careful, don't throw parties, and definitely do not go visiting a nursing home. They are the most vulnerable people, and this is not the time to be visiting them. Yes, I understand your mother is there, your father is there, but it's safer to be at home than to be visiting them.
In fact, the governor yesterday or a couple of days ago, he talked about that issue. I know today he talked about a particular Orange County nursing facility that has 60 cases, and it's really rampant there. But he said one of the toughest things about this are the number of people who are having to fight this virus alone, and sometimes, unfortunately, even die alone. And that's very tough on the families as well as individuals. So the more we can practice social distancing, the more we probably can save ourselves from those types of situations. Dr. Pradeep, really thankful for you being on today. Really appreciate your time again.
Thank you.
Yes, sir. And again, thank everybody for watching. If you haven't signed up already, make sure you sign up for our breaking news text alerts. We certainly expect a few more breaking news items to happen, not only this week, but going into next week. And I mean, I won't prelude some of that just based on what I'm seeing happen between the spike in cases to maybe some legislation happening in D.C. on the Hill right now. A lot of things that could impact your family, from unemployment to medical supplies to even just as simple as preventing the coronavirus from hitting your household. So please make sure you do that. Just text the keyword NN to 484848. And thank Dr. Travis Town for helping to run the technical side of this broadcast. And also thanks to Letha Thrower for helping to manage the social media side. And as always, please make sure you wash your hands.